Well, welcome back to Everyday Iowa. Well, it's going to be here before you know it, cold and flu season, and we want to make sure that you and your family are safe. And to that point, Dr. Pramod Dwivedi with us from Linn County Public Health. We've been practicing this in the lobby.
Yeah.
Real quick, Dr. Pramod was going to be with us a few weeks ago. We got preempted because of a special report, so thank you for coming back and being with us. You made it as far as you've been. Last week you didn't even make it to the studio. You're here today. Thanks for the time, and let's get a little serious here because 'tis the season. The weather's changing. We got to start thinking about cold and flu. So talk a little bit about what we can do now, and then we'll kind of get into some more specifics.
First of all, thank you for having me on. And as weather changes, winter is always an issue for from public health point of view, because people are indoors and the air is dry, so there is much more vulnerability there with regard to respiratory diseases. So, you know, the common sense is really we get ready for before winter comes, right? With regard to clothing, we need good coat, good gloves, good boots, good hats, everything. So similarly, we should also be ready to prevent our health. So for that, we need to get vaccinated. And obviously, as I said, that, you know, weather is so not conducive to our health, especially for our respiratory problems. We need to be aware of the fact that we should be washing our hands. And when we have cough, cover our cough, cover our sneeze, and when we are ill or sick, stay home.
And so that's probably the hardest part, because nobody likes, you know, having to stay home, but, you know, cover the cough. And when do you know, all right, I just need to stay home, don't plow through it, I'm sick? What are some of the signs?
I mean, your body would tell you already that, you know, it is really important thing that we should not be out and about, because you are also not protecting just yourself, you are also protecting others, because if you are ill or sick, you are going to transfer that virus to other people. Especially that happens more often in winter, as we talked, that we are indoors and the air is dry and there is a hypersensitive response from your lungs, you know, bronchial response. So
Dr. Pramod along with us this morning here. Now we're seeing video. People are getting the flu shots. We were just talking in the lobby. We were offered, a lot of employers offer flu shot clinics. Good idea to get that.
Absolutely, good idea to get that, because, you know, each year, as we were talking before, that virus mutate. So our scientists, through rigorous scientific way, they develop or modify the vaccine to counter the new mutated virus. So we are safe. And we are safe also because, you know, we are not transferring that disease to other people, less likely to transfer if we are vaccinated. We are less likely to hospitalized. We are less likely to be severely ill if we are vaccinated. I mean, those, you know, just common sense, you know, for all of us.
Wash your hands. It's probably the biggest thing. We got used to doing that in 2020, and maybe we got a little lax on it, but wash, wash, wash.
Wash, absolutely. I mean, that's the bedrock of prevention, you know. These 10 suckers, that's what they say. So, absolutely.
Real quick, I was asking you in the lobby about COVID boosters. We're kind of hearing more about that. Tell me a little bit about that, too.
So, we have, you know, as we were talking about before, that there is always variation in virus, how it changes, the mutation, you know, scientific term is mutation. So in order to keep track of that, or in order to, you know, encounter or protect ourselves, scientists, again, you know, with rigorous scientific way, they develop the new vaccine so that it can, you know, protect us from the new circulating virus in our community. So that's why it's really important. So when you are getting, you know, vaccine shot, it's not a bad idea to get your booster, COVID-19 booster shot as well, and you can get both together.
Wash your hands, get your shots. Don't shake hands. I'm going back to the fist bump. Dr. Pramod, thank you for being here this morning.
Yes,
You'll
absolutely.
come back and visit us, right?
And one more thing before I go, that most insurance cover it, but if you do not have insurance, please don't worry. We'll take care of you. Call our clinic here.
We put the info up there, right there.
892-6093. Please call that. And flu vaccine is widely available in our community. You can talk to your healthcare provider, you can talk to your pharmacy, and you can certainly call us, and we'll be happy to help you.
There you go. Always good to see you. And making it on camera this time. We'll get you the second time, too.
And very good that you are doing this good thing for our community, our neighbors. I think this is awesome.
Well, we appreciate you're now one of our recurring guests, so you're on standby. In the meantime,